I'm David Hawkins. I'm a professor of social work, sociology, and education at the University of Washington. I developed communities of care with Richard Catalano. Before I was a professor, I was a probation officer. I worked with delinquent youngsters. The kids I worked with liked nothing more than to get loaded and rip people off. It was my job to help them get back in school or stay in school, get an education, to help them to get along with their mom so they didn't get kicked out of the house and I had to put them in a group home. I began to ask myself this question, isn't there something we should have done before these kids got to this place? I became very interested in the concept of prevention. But 35 years ago, we didn't know how to prevent delinquency and substance abuse. By 1980, there had been 9 experiments testing different approaches to preventing delinquency in this country. None of them had been effective. In the late 1970s, people concerned with teen substance use developed drug information programs, and they took them into schools thinking that if they taught kids about these drugs and the risks of using them, that they wouldn't use. But in fact, evaluations of those drug information programs showed that in the year following the program, the children who were exposed to those drug information programs were more likely to use drugs than children who hadn't been exposed to the program. We've had a sea change in prevention in the last 35 years due to something called prevention science. Serious efforts at prevention science began with heart and lung disease. Heart and lung disease is responsible for 1 out of every 3 deaths of people in the United States. But did you know that since 1999, we've had a 32% reduction in the relative risk of death due to heart and lung disease? How did that happen? Well, some of it's due to better treatment, but also because people became concerned with preventing heart disease before it happened. The doctors realized that if you want to prevent a problem before it happens, you need to address and reduce the predictors of that problem. So we need to reduce factors that increase the likelihood of problems. We call these risk factors. We need to increase the factors that have been shown to buffer against or protect against the development of problems like heart and lung disease. We call these protective factors. Today, if we were talking about heart and lung disease, you'd know what those risk factors are. What are they? Well, smoking, a diet high in fat, sedentary lifestyle, family history of heart and lung disease. Once we began to understand these risk factors, we began to change policies and behaviors to reduce them. Today, if you're meeting in a public place, I'll bet nobody is smoking in the room where you're meeting. 35 years ago, there would have been ashtrays on the table. And today in America, if you don't exercise, at least you feel guilty. The exciting thing is that now prevention scientists have been able to apply prevention science to the prevention of adolescent health and behavior problems. Problems like violence, substance abuse, delinquency, teen pregnancy, school dropout, even depression and anxiety. Prevention scientists have identified risk factors that increase the risk of these health and behavior problems in young people and protective factors that buffer against the development of those behavior problems. Moreover, prevention scientists have developed and tested prevention programs and policies that reduce risk and enhance protection and prevent health and behavior problems. In America today, there are over 40 tested and effective prevention programs for preventing adolescent problem behaviors. Communities that care will help your community identify those risk factors that are most widespread in your community and affecting the most young people, and choose tested and effective programs to implement within your community that address those elevated risks in your community, as well as enhance protection. What are examples? Parenting programs that help strengthen family bonding and communicate clear standards for their children's behavior. Curricula in schools that help young people develop life skills. Policies that help reduce availability and access of tobacco and alcohol for young people. I've seen communities using communities of care across this country make big changes. They've reduced risk and enhanced protection, and they've seen measurable improvements in the health and safety of their young people.